Yeah, very good afternoon. And I welcome all of you for the second day of the 3-day webinar on tips for healthy and safety well-being. Today, we have with us Dr. Karishma, consultant in Department of Obstetrics and Gynecology, KIMS, Bengaluru. Here is a brief introduction about Madam. Madam has pursued her MBBS at Vaidehi Institute of Medical Sciences and Research Center, Bengaluru, in the year 2014. She has done her MS at JSS Medical College, Mysuru, in the year 2018. Currently, she has been working as consultant in the Department of Obstetrics and Gynecology at Kempegowda Institute of Medical Sciences, Bengaluru, from November 2019 to till date. She has been a registrar in the Department of Obstetrics and Gynecology at Clouding Hospital, Bengaluru, from December 2018 to May 2019. Her work front areas are: she regularly takes care of outpatient in the Department of Obstetrics and Gynecology. She has been handling obstetrics emergencies and high-risk pregnancies. She has done several normal deliveries. She has done instrumental deliveries and cesarean sections. She has actively participated in teaching programs organized for undergraduates and postgraduates. She has undergone training at USG training through the FOGSI FMF India program 2021, training advanced laparoscopy IMMAST Mumbai 2021. Her professional achievements and activities includes following. She has attended AICOG 2018 as a delegate at Bhubaneswar and presented a paper. She has participated as a delegate in the colposcopy workshop conducted by Mysuru Obstetrics and Gynecological Society in 2017. She has participated as a delegate and presented an interesting case in APGAR2 and FOGSI Force program conducted at Kasturba Medical College, Mangaluru in 2017. She has participated as a delegate in IAGE Subzone Workshop and Conference Endovision in 2016 held at St. John's Auditorium, Bengaluru. She has been participated as a delegate in Karnataka State Obstetrics and Gynecology Association 2016 held at Sri B.M. Patil Medical College, Vijaypur. She has participated as a delegate in Karnataka State Obstetrics and Gynecology Association in 2015 held at GSS Medical College, Mysuru, and presented a poster. She has presented she has done poster presentation titled Successful Management of Severe Oligohydramnios of AFI 1 centimeter at 25 weeks of pregnancy, presented at Karnataka State Obstetrics and Gynecology Association 2015. Another poster titled Large Adnexal Mass, Is Laparoscopic Surgery Safe?, presented at All India Congress of Obstetrics and Gynecology 2018. She has published several publications. She is a member of Bangalore Society of Obstetrics and Gynecology. We welcome you, madam. Over to you. A very good afternoon to all the participants of this webinar today. I'm very grateful to ma'am to have invited me for this talk today and overwhelmed by the words that she just spoke. So, in fact, I'm grateful to her to give me this platform today where I could speak about a very important topic which is not very well highlighted, because women, as we know, are always looking after others. They're looking after their family members. They're looking after people around them, be it at home, be it at work. But the last one that they think of is themselves. So I'm grateful to ma'am to give me this opportunity. I'm privileged to be here today to discuss about this important topic so that I can do my part in this. Being a gynecologist, I would like to discuss some important aspects, some important points, and I hope most of you today will take home a few messages and will draw some benefit out of it today. So what is well-being? Well-being as such includes both physical health, emotional health, mental health, and it is the overall picture of a person, not just physical fitness. So what I already told here is that behind every successful woman is herself. And that is why today's talk is going on, so that I can highlight the importance of self-care, because I know most of you here today are juggling between work, between home, between lot of other things which are happening around you, but you have most often, you don't remember about yourself. You don't even look after yourself. You think that others are a priority, whereas you forget about yourself, because that's how women are. They are always caregivers. They are the nurturers, but then they do not remember themselves. And that is why we're highlighting this today, that women are mothers, they are daughters, they are daughters-in-law, they're looking after people around them. They're simultaneously handling multiple tasks together and doing that very proudly and gracefully. But at the same time, this is just a small reminder that while you do this with so much of grace, do remember to look after yourself, because at the end of the day, you are important and you're the one who's going to stand there like a pillar of support and then look after people around you and continue to do so. So leaders at home and also leaders at work. Definitely, I'm sure most of the participants here are doing masterly well. They are having they are having leadership skills at work, and that's why they're organizing this today. And I'm sure they're great homemakers as well simultaneously. So just to remind you all that because you are such a great multitasker, you are the one who's supposed to look after yourself first, because I know you will continue to look after the people around you as you have been doing so far. So continue to look after yourself as well, so that you can be the supporting pillar to your family. So what is wellness? It is basically harmony of the mind and the body. So it involves physical fitness and also healthy lifestyle habits. Okay, so stress management is a part of today's lifestyle, because stress is something which is hampering the health in many aspects. So do remember that stress management is an equally important part for you to stay fit and healthy. And of course, diet, I would say, forms the core of your good health. So coming to what a balanced diet should be like. So we see that many young women or even people of the middle age group, many of them are going for crash diets. They believe that, sudden weight loss is going to help them. And what they believe is that stratifying their food into carbohydrates, proteins, avoiding rice, avoiding chapati, and having only, say, egg or meat, or only proteinaceous diet is going to help them lose weight all of a sudden, and they're going to be all hale and hearty and fit and healthy. But I just want to remind you that what you're seeing today around you is a myth. Please don't do such things. Do not divide your meals, or do not sort of divide the whole balanced diet into proteins, carbohydrates. That's not what you're supposed to do. You're supposed to do something very simple. All you're supposed to do is follow what your grandmother followed. Follow a food habit which is very local, which is something which is available in your area, in your place, which is very traditional. Okay, which is very simple. You do not have to go and buy something from the market which says low fat, which says ragi, oats, and things like that. That is somebody who's packing it, who's publicizing it, and who is probably making a benefit out of it. But what you are supposed to do is something very simple, something which you can follow for a long time, something which you can sustain. So all I would say is the core of your health itself starts with a good healthy meal, a good healthy diet, where you're taking everything in small proportions. So
Well, what people are following today is completely avoiding rice, or they believe that carbohydrates should be completely avoided and overnight you're going to have weight loss. Please do not follow that. Take a lot of fresh colored fruits. They will provide you with a lot of micronutrients that are required. Fruits and vegetables which are locally available are fair enough. They're in fact very good. So adequate protein should be included in your diet, be it even if you're a vegetarian, there are a lot of protein sources which you should take an effort to include in your meal. And small meals which are well balanced and adequately spaced will definitely help you to lose your weight. Even if you are trying to, if you belong to those that part of the society, you should still follow a healthy balanced meal and not divide your meals. And just highlighting a little importance about iron and calcium supplements, because we are talking about women's health today. So young adolescent girls who are in the menstrual age group or in the childbearing age group, so definitely a lot of iron supplements would be beneficial to them. So be it in their meals or even additional iron supplements which are available, your doctor can prescribe them for you. You should be taking them on and off. And so is it for the women, say in the perimenopausal age group, they should start taking calcium supplements on and off along with vitamin D supplements, which will be very helpful to them, because the physiology is such that the body starts losing calcium. The bone metabolism is slightly altered in that age group. So it is very much important that you are aware of this requirement so that you can start taking these medications. Many of you might not be aware of these things, or even if you're aware, you're hesitant, or you have not been told by somebody, or you've been told something by somebody which you are still doubtful about. So I hope this sort of helps you all. Okay, and physical activity, I just want to highlight that whether you are somebody who's trying to lose weight, or you're just trying to, you think you're all fine, you're hale and hearty, whatever the scenario is, just remember, for everybody, physical activity is a must. It is something which is supposed to be a part of your daily routine, not just because you're trying to lose weight or you think you're all fine, you're slim and trim, you do not require it. No, please do not believe in that. It is absolutely essential. Whatever BMI you belong to, it is not just for weight loss that I'm talking about physical activity. It is for your physical fitness. It is for your mental health. It is for an overall balance, because it will help maintain your cardiac output, your heart rate. Everything is dependent on the kind of activity your body is accustomed to. So physical activity is a must and should for everybody. So as I've discussed, micronutrients and macronutrients both are important, and both will be achieved if you follow a balanced diet where you have a lot of fruits, vegetables, nuts, along with your usual, chapati or even rice and dals and, meat. Even if you're a vegetarian or a non-vegetarian, have a balanced meal so that all these things can be provided. So especially important is folic acid, especially for the childbearing age group and the young girls, along with vitamins like vitamin B6, vitamin B12. And as I said, calcium and vitamin D, along with iron supplements, are extremely important. So as a gynecologist, I would just like to highlight a few points, a few common, I would not say diseases, but a few common problems that, you would have faced. So we will just go about it through all age groups. So starting from the younger population to probably a slightly older one also. So we will start with the basic ones. So as I said, these are not problems as such. They are probably some things which you have faced once or twice in a while, where you feel like, you're not aware of what is to be done. You do not know if it is really a problem, if you need to seek help, you're anxious about it. Somebody else has told you about, something related to this, and then you have drawn your own conclusions and you believe that you have a problem. So to overcome this, I believe that whatever few words I will be saying today, you will have a few messages that you can take home, and probably it will relieve your anxiety. Or if you have some problems, you can definitely ask me at the end of this session also. So starting with the adolescent girls and, the reproductive age group women, looking at the common menstrual problems that they might be facing. So menstrual problems are still considered a taboo in many places, even though in today's era, we do know that people are much aware about it. They have access to information. Okay. And the taboo is slowly weaning off, I would say, but it is still something not very well discussed. And more so, I'm discussing this so that the younger girls, okay, they are sort of well educated about this, so that they take it in their stride when they enter this age group. Okay. So what are the common problems that we see women coming to us with? So first and foremost, irregular cycles. I'm sure at one point or the other, most of you have faced this problem, and most of you have had 1 or 2 episodes where you are anxious about it and you do feel like you need to ask somebody, but you still don't know whether to consult or whether to just let it be at that. Okay, so irregular cycles. First of all, what is a regular cycle? So what I would say is, most of you are of the belief, I suppose, that a regular cycle is one that happens once in 30 days or exactly once in 28 days. Okay, but that's not how it is. So for you to know, there is a wide range actually. So a gap of 21 days between two menstrual periods is also considered normal, and a gap of 35 days between two periods is also considered normal. So as you can see, there's a wide range. So between 21 days to 35 days, an interval between two cycles is absolutely considered normal. So if you are falling in any of these in this range, then definitely, if you were worried, please do not be worried anymore. Okay, so the next one that I have mentioned here is menorrhagia. So what is menorrhagia? Menorrhagia is basically if you feel like you're having excessive bleeding during your period. So many of you might have experienced this once in a while. So as such, menorrhagia is heavy bleeding or bleeding which is lasting for longer than 7 days. So a normal period would usually last for about 3 to 5 days. But if you feel like you have a bleeding which is lasting for 7 or more days, then definitely you should go and seek help, or you should meet your doctor. Or if you feel like you're changing too many pads a day, there's a difference between what it was earlier as compared to what it is at present, or you feel like your sleep at night is disturbed because you're having to change pads at night, then definitely you need to seek help and you need to meet your doctor. Okay, another common problem, especially in young girls, that we see is that they complain of a painful period. Okay, and many a times we see that the mothers are worried and the children are worried or the young girls are worried. So what do you do when you're experiencing this? So first of all, what is normal and what is abnormal is what you need to know. So usually in ovulatory cycles, which are the normal menstrual cycles, some amount of pain does happen and it is absolutely normal. It is physiological. But how will you know if you're having that? So this kind of pain usually happens only on the first day of your period and is usually, it generally subsides by the end of the first day or at the most up to the second day. Okay, it is a spasmodic kind of pain which comes and goes. But if you're having painful period which is lasting for longer than this, or it is starting even before the onset of your period, then you should consider that, there might be something which you need to seek help for. But otherwise, if you have mild pain only on the first day or even up to the second day, then it is absolutely physiological. You can take your regular painkillers if you are used to taking, there's no harm if you take those, and you should be fine with that. Okay, coming to menstrual hygiene, I believe that most of the participants here are very privileged and they know about these topics. Why I'm talking about this here today is that because I know that most of you can go ahead and spread the word. You can educate people around you, maybe the maid who works in your house, maybe her daughter, maybe somebody who's not as privileged as you but is around you, and you are able to provide some information to them and make a difference to them. Okay, so that is why we are discussing this today. So Menstrual Hygiene Day is celebrated. It is marked on 28th of May every year. It is an International Menstrual Hygiene Day. And it is basically in order to overcome this taboo that is associated with discussing menstrual problems. After all, it is something very physiological. And you need to discuss about this openly so that people around you can be benefited. The taboo is resolved. Okay, so that is the aim. And that is why this day is being marked. Okay, so nothing much. I'm sure all of you are already aware.
This is not responding. This is not responding. What is the number? Okay, go ahead.
I'm sorry, there was a disruption. Sorry for this. I hope you can hear me now. So menstrual hygiene, as I was saying, most of you are already well aware about this, but I think you all can go ahead and spread the word and, help in overcoming this taboo so that people around you who are not as privileged are benefited, and even young girls can take it into their stride as they enter this phase. Okay, so nothing much as such. It's just that you have maintained perineal hygiene, wear washed undergarments, cotton undergarments, and you can use sanitary napkins if you're used to that. Change them once in 4 to 6 hours, and disposal should be done properly. Okay, and just a word about menstrual cups, because I think many of you might be considering this but have still not started to use them because you believe, or you have some disbeliefs, or somebody else has told you it is difficult to use, or you have read something about it but you really don't know what the truth is. So just a little bit about menstrual cups. So they can be used in all age groups, including young virgin girls. Okay, there is no harm in using these cups. They're available in different sizes. So they can start with a small size. It is available in small, medium, and large. And they're very cost effective also, because you can use one cup, has a life of about 10 years. So definitely, instead of using pads for over a period of time, the cost effectiveness of this is very good. Okay, and also they're easy to use and reuse. There is nothing much. They are available as silicone cups. Maybe the first time when you're using it, you can just sterilize it by using it in by putting it in boiling water for 3 to 5 minutes, and thereafter it's ready to use. And maybe in the beginning, when you're starting to use, you can use it along with a menstrual pad for a couple of days until you're accustomed to this, and then you can go ahead with the use. So it has to be folded and placed, and you remember to wash your hands before removing it and before placing it. Okay, and as such, before reusing it, you can just wash it with water or soapy water, and probably before your next period, after you're finishing one period, you can again sterilize it using boiling water, I've said. Okay, so after menstrual problems, we look at another common problem, which I'm sure most of you have heard of. Either your friend or a relative or somebody around you has been told that they have PCOS, and either they are very anxious about it, or they're just seeking doctors, one doctor after the other, because they think that it is something which has to be treated on and off, and it is something which is a disease. But I just want to tell you that it is not a disease. It is actually a lifestyle disorder is what I would call it. Okay, it is not something which, you just go to the doctor and it is labeled as a disease and you just pop 1 or 2 pills and you're done with it and you're treated. That's not how it is. Why I'm discussing this here is that it is a very common problem in today's world, because of the associated stress and the lifestyle that people are following. And many a times, people, you are just labeled to have this problem and you do not know how to go ahead about it, or you are just very anxious and you're trying to seek help, but you feel like there is not much of benefit that you're seeking even after seeking help with multiple doctors. Okay, so why I want you to know this is because it is a lifestyle disorder, and we are here today to discuss how a woman should look after herself. So what happens in PCOS? So basically, there are three important points that will manifest in order to be labeled as PCOS. Either you have some sort of a menstrual irregularity where you feel like your periods are irregular, where you feel like you're having periods less frequently, say more than 35 days is the interval between your periods. Or the other factor that you would have noticed is that you have started developing a lot of acne, or you feel like there is some kind of a male pattern hair growth, especially facial hair, coarse midline hair. Okay, that is development of hair over your chin area, or development of hair over the chest. Okay, so all these are because of hormonal imbalances that have happened. Okay, there are more of male hormones that are being produced, and that is why you're having these kind of androgenic features, or the what we call this hair growth is called as hirsutism, along with acne. Or the other feature, one of the other features that could be there is that you have gone to a doctor and they have done a scan, and after the scan, they have told you that the morphology, that is the appearance of your ovaries, is such that they are cystic. So if any of these 2 points are also satisfied, then you would be labeled as PCOS. Okay, so now what I want you to know is that even if you're labeled as this, or somebody around you who's told you that they're labeled as this, there's nothing to panic. Okay, so it is not a disease that you just go and you take a pill and it's just done with. So basically, it is a lifestyle disorder. And why I'm discussing this is, again, I want to highlight the importance of a good lifestyle, of a good routine. You have to follow a diet, first of all, that is sustainable. So take something. So that's what I'm saying. No, if usually what happens is PCOS is associated with obesity, and obesity itself adds to a lot of other problems that are seen with this PCOS. So they both go hand in hand. So only after the obesity is come to a level, it has come to a control, will the disease pattern also come to a control. Okay, it is not like overnight it's going to settle down. It's going to take a long time, and it's going to settle only after your lifestyle has come to a particular routine where you feel like, you know, you have a good dietary habit, you're taking a good balanced meal, and you're going to sustain that. You're going to be able to take the same kind of food throughout. It's not like you've taken a crash diet and you're going to lose 10 kgs over a month suddenly, and then you feel like your disease is over. No, it's not how it's going to work. You have to follow something which you can sustain for years to come. And that is why I'm telling you, follow the local traditional method of meal patterns instead of going for crash diets. A good amount of physical activity is a must and should. As I've already told, it is a lifestyle which you have to maintain. Of course, sleep has a very important role. A good balance, a good rest, good amount of rest is a must and should to control stress as well. And stop worrying, stop labeling yourself as somebody who has a disease. It is a lifestyle disorder and can be very much controlled with your own efforts and your own routine if you maintain one. Okay, there are some medications that can help. If you feel like you need those, or you feel help, you can always seek the help of a doctor. Feel like you need help, you can go to a doctor and discuss this further. But the mainstay of this problem, if you've been told that you have this, is definitely a lifestyle modification, which is going to play wonders, which is going to really help control this disease, because there are other problems associated with it, like you might be prone for getting diabetes in the future, because this problem is associated with insulin resistance, which make you prone for some kind of an abnormality in your body's sugar metabolism. So you are more prone for developing diabetes in the future. And that is why I'm highlighting that this is an important factor. Your lifestyle is going to look after your health, and you are going to look after your lifestyle. You are going to form your routine so that your health is in its place. Okay, so a healthy lifestyle with exercise, weight loss, and reducing stress and anxiety with good amount of sleep is going to look after the whole thing. And the next important aspect, or the next important worry that most patients come with, is discharge per vagina. Okay, so many a times we have women who are coming with this problem, or you know, they've constantly been coming, and we keep examining them and we tell them that there is no actual problem. Okay, whereas we do see people who come with a lot of problem and who have not realized this earlier. They feel like there was no problem at all, and this is just been sitting with it, and one fine day they come and the problem has actually increased. So I just want to discuss this point so that we can just have a word about when it actually is a problem and when it is not. Okay, so because discharge per vagina is actually physiological, that means it is normal. So when do you have to worry about it? When will you know that it is abnormal? So a healthy vaginal discharge is usually clear or whitish with a slight odor. It is not a foul-smelling discharge. It can leave a yellowish tint on the garment, and the consistency changes throughout the menstrual cycle. Okay, whereas if it is an abnormal discharge, it is either yellowish or greenish or thick, curdy white. Okay, and it can be frothy. It can usually be associated with a foul smell. It could be blood stain. It is associated with itching. It could be associated with pain in your tummy. It could be associated with fever, on and off. Okay, so if these are the problems, if you think you're having such a discharge associated with so and so problems that I have mentioned, like lower abdominal pain, fever, okay, discomfort during sexual activity, or a curdy white discharge associated with itching, on a frothy green discharge, then you really need to seek help. And not just you also need to probably take your partner along with you, so that both of you could be treated simultaneously, and you will be in a position where you will be able to prevent such a recurrence. Okay, so that is why I'm highlighting that the treatment is always for both the partners in this kind of a scenario. Of course, you need to rule out some other problems which could be associated with this. For example, a diabetic lady would be more prone to developing these infections, which are usually sexually transmitted, and these infections are bringing about this vaginal discharge. which you need to be aware of. So do visit your doctor if you feel like you have a discharge associated with these problems, so that you can be treated, your partner can be treated, your other problems like diabetes needs to be ruled out. And to prevent these problems, you should use barrier methods of contraception. Okay, so that will prevent spread of sexually transmitted diseases. Moving on to the women in the reproductive age group. So in today's era where careers are playing a very important role, where a woman is trying to balance both simultaneously and is doing very well at that, I just want to tell you that stay there, you're doing very well. So previously, there was a notion that the family should be completed very early, but we know that today things have changed. So even as per FIGO, the elderly primary, that is a lady who's conceived for the first time, is considered to be elderly if the age is around 35 years. Okay, so that is the definition of an elderly primary gravida. As such, what I would like to tell you is that when you're preparing for pregnancy, when you and your partner are ready for it, you can visit your doctor so that they can talk to you about a few important things. You have to be both physically and mentally fit and prepared for the future pregnancy that you are planning for. Okay, so one important thing that I would like to highlight is that you should start taking some nutrition supplements. It's extremely important that you start taking folic acid supplements. Okay, you can take it probably when you're 3 months away from, when you're just deciding to conceive. They can be taken in the preconceptional period. Okay, also if you have some other problems, say in the past, if you have had some problems, say you've had fits, or you feel like there were some other problems that you need to discuss about, or you are a diabetic, or you're taking other medications for hypertension, then you need to discuss this well in advance with your doctor, so that the medications can be altered and the ones which are suitable to be taken during pregnancy can be given right away, so that you don't conceive, because the first 3 months of your pregnancy are the most important. That is the time when the fetus is developing, when your baby is developing, and almost everything is already done by the end of 12 weeks of your pregnancy, and that's when many people start visiting their doctor. But by then, if you have already taken certain medications, if you have already had some problems, then that would have already affected the fetus. So it is important for you to discuss with your doctor prior to conceiving itself. If there are any medications that you were taking, you should highlight this to your doctor so that they can be changed, and so that they can be the ones which are suitable for your pregnancy, starting right from the beginning of the pregnancy. Okay, and of course, you all know that if you are into alcohol or smoking, then you should definitely stop those while you're planning your pregnancy. So before you conceive, you need to see your doctor once for these points. Okay, moving on to women belonging to the perimenopausal or the menopausal age group. So generally between 45 to 55 years, we say around 50 to 52, most women would have attained menopause. So what is menopause? So it is basically a retrospective term that we use. So once there is cessation of menses or absence of periods for about 12 months, then we can label that the woman has undergone menopause, or she has achieved menopause. It is completely physiological. It is one point where all of us have to reach. So it is better to be prepared physically and mentally to attain that, instead of fussing about it or, fretting about it. So there are some changes that happen to every woman during that period. So if you are somewhat aware about this, you will be able to accept it better while you're going through it. So that is the point of us discussing this today. So what are the, I wouldn't say problems, they are the manifestations that you will face in your perimenopausal, just 2 to 3 years before you finally achieve your menopause. These are the things that you might experience, and they might be worrisome to some of you. Some of you might wonder if things are normal or you need to seek help. So if we have a word about this, maybe some of your worries will be somewhat settled if we discuss this today. So there can be some menstrual irregularities that can happen prior to, or in the perimenopausal age group. You might have irregular cycles, you might have cycles probably once in 2 to 3 months, or sometimes what happens is you start having very heavy flow, and that happens only once in 2 to 3 months. Okay, hot flushes are one important thing. See, what happens during menopause is that the ovarian function finally starts reducing, and the hormones that the ovary is producing normally will start reducing. So basically, it is a different form of hormonal imbalance that is happening, but that is physiological. Okay, so it is the reduction of the estrogen finally, which is causing all these manifestations. I wouldn't call them problems. They are the manifestations that are completely physiological and you will have to deal with them. So if you're mentally prepared, you will be able to deal with them better. Hot flushes and night sweats are again happening because of estrogen deficiency. You might have some mood swings. As you know, bone metabolism is again sort of, the estrogen, which was earlier looking after it, is now reducing. So the bone metabolism is also different from what it used to be in the earlier period. Okay, so you're more prone for developing osteoporosis. As I said, you should start taking calcium and vitamin D supplements during this period. You might have some urinary disturbances because the tone of your musculature, of your muscles, is also maintained by the hormone estrogen. So as that is becoming deficient, you might have some manifestations such as vaginal dryness or difficulty in sexual intercourse, loss of elasticity of the skin, and thinning of the hair. So these are things that you might experience. So don't worry about it. All you need to do is, as I have already said, the core is your lifestyle, the core is your diet, the core is your physical activity, which you need to maintain throughout, be it any age group. So that is going to form the core of your health overall. Okay, of course, you should reduce taking alcohol or smoking if you're into it, and reduce coffee intake as well. Adequate calcium supplements and vitamin D3 supplements, as I'm already telling. Also, the estrogen plays a very important role in your in different metabolisms, and they protect you from various diseases such as heart disease, developing diabetes, developing hypertension, your fat metabolism. Everything is looked after, and estrogen plays an important role. And as you know that is the hormone which is reducing now, you might be prone for these diseases, and hence you need to see your doctor, maybe to just get your baseline check, your lipid profile, your check your BP, you can check your sugars and just see how you're going so far. Okay, so as I said, your lifestyle is the key to it. Okay, now we'll move to the next area for today, which we are discussing, which is I consider to be privileged as I sit here today to talk about this aspect today, about preventive gynecology. Okay, so being a gynecologist, I just want to make you aware that there are certain diseases which can actually be picked up very early. In fact, they can be prevented if certain points are picked up very early. All you need to know is that there are these points which you should seek, or you should get these things done so that you can prevent yourselves from being in problems later on. Okay, so if you're aware that there are certain tests that you need to get done, or there are certain vaccines available, or there are certain measures that you can take well in advance, you will be protecting yourself from a disaster much later on. Okay, I'm not saying that all of you are going to have this problem, definitely not, but cervical cancer is a very common problem in our country, and it is very important for all of you to know that which very basic steps you can prevent yourself from developing this problem. And if you are aware about these things, you can also spread the word to people around you who are probably not having access to this kind of a forum. So for cervical cancer, there are certain risk factors. So sexually transmitted diseases, early exposure to sexual intercourse, multiple sexual partners, poor hygiene, and certain immunodeficient parameters. Okay, so basically what happens is, what we are trying to discuss here is about HPV vaccines and a screening test for cervical cancer in the form of Pap Smear. A screening test is nothing but a test which will help in early detection of a problem, so that early steps can be taken to prevent a final problem which can happen much later on. So it is basically a simple test which is easily available, which is cheap, which can be applied to a large population, so that a large number of people can undergo a basic test, and those who are prone to develop a disease later on can be picked up early, can be diagnosed early, and can be treated at the earliest, so that a large problem does not occur at a later date. So in relation to cervical cancer, there are certain things that you need to be aware of: delaying sexual intercourse until physiological maturity, using barrier methods, as I said, to prevent sexually transmitted infections, which make, the human papilloma virus, it is an infection which is sexually transmitted, which makes one prone to develop these kind of problems or cancers later on. So restrict the number of sexual partners, and maintaining local hygiene both for the male and for the female partner, and reducing smoking. Okay, so I'm sure all of you have heard about HPV vaccines. So there is a bivalent vaccine and there is a quadrivalent vaccine available. So these are the Cervarix, and the quadrivalent one is the Gardasil vaccine, which is available. So broadly speaking, the schedule of this vaccine is 3 doses, that is 0. That is the first dose at 0. Then the next dose between 1 to 2 months after the first dose, and the third dose after 6 months. So this one applies to people who are above 15 years of age. Okay, the vaccine can actually be taken from 9 to 11 years of age itself. In the initial period between 9 to 11 years, if you're starting with the vaccine, 2 doses should suffice. If you're taking the vaccine after 15 years of age, then it requires 3 doses. Okay, but what I want to highlight to the people here today is that the vaccine can be taken up to 26 years of age. After 26 years of age, from 26 to 45, it is the gray area where you should go and speak to your doctor if you're interested in taking the vaccine. And why is it so? It is because most of us would have already been exposed to the virus and would have already developed the antibodies required after that, in that age group, in that 26 to 45 age group. So it is ideal that you take the vaccine in the earlier age, okay, because it is not going to be of much benefit to you after that. So up to 26 years, the vaccine, the recommendation is there, but between 26 to 45, it is a gray area and nothing after that. And I've told you the reason is because we are taking a vaccine against, this is something which is sexually transmitted, and most of us would have already been exposed to that by that age group. Okay, and as I've told you, the dosage in the early years is only 2 doses are required, but after that, after 15 years, we recommend 3 doses. Okay, as I said about a screening test which is available for cervical cancer, which is called as the Pap Smear, or nothing but LBC, which is liquid-based cytology. So I would sincerely request all of you to get this test done. It is a very basic procedure. There is nothing much. You're not going to have any pain. It is inexpensive. It hardly takes 2 minutes. All you have to do is visit the OPD, meet one of the doctors there, and they're going to do this for you right away. It does not require any preparation. You can just walk in and walk out. Okay, so this is how it is done. You will just be put on the examination table and you will just be examined. And while you're being examined, there is something called as a cyto brush, as you can see here. This will just be inserted locally and a smear will be taken from your cervix, which is absolutely painless. You will not realize anything. Okay, it is just like a walk-in and walk-out procedure. It hardly takes about 2 minutes. Okay, all you have to do is know that there is a simple test like this, as simple as this, which will help pick up any abnormalities. The cells that we pick up here will be sent for examination under a microscope. And if there are any problems, they will be detected at a very early stage. You will not require any advanced treatment thereafter. It will be something very simple compared to what it will be if you develop a condition like cervical cancer. So basically, it is to prevent you from developing an illness to that extent. It is basically to pick up any abnormality at the earliest and help you out. Okay, so the screening as such starts at 21 years of age. That is recommended. It should be done once every 2 years until 30 years of age. After 30 years, it should be done once every 3 years, and it can be done up to 65 years of age, provided the previous decade had normal smears. Okay. So moving on to the self breast examination. So this is again to prevent you from developing a large disease or a problematic condition much later on. So this can be done by you, or you can get a clinical breast examination done by your doctor, which could be done. So this I think is much easier because you yourself can be the judge for yourself. All you have to do is stand facing the mirror. You can either stand with your arms by your side, or you can stand with your arms on your hips, and you can use the pulp of your fingers to just palpate or to just examine both your breasts. You should see the symmetry. You should see if there are any nipple abnormalities, if you find any lump, if you think there is any discharge or milky discharge or a watery discharge or a bloody discharge, you should seek help right away. So again, this is what I would say. It is to help pick up a problem at a very early stage. You yourself can do it. All you need to do is to care, is to look after yourself, to care, to think about yourself first. So that is the first step. From the beginning, I've been telling, put yourself on the top, make yourself a priority, because you are important not just for yourself, but for the entire family, for everybody else around you who's very much dependent on you. I know in all your families, you are the leaders, you are the ones who are running the show both at home as well as at work. Okay, a little about postmenopausal bleeding, since we are discussing preventive gynecology. This is something I want to highlight. Uh, See, what happens is once menopause is attained, that is, once there has been amenorrhea or a period-free interval of about 12 months, we say that the lady has achieved menopause. What happens is that some of them will experience 1 or 2 episodes of bleeding even after that, and they might just think it's okay to have that. But I am here to highlight very clearly that once you have achieved menopause, that is, once you have not had period for 1 year, you are told to have achieved menopause. And anytime you experience any bleeding, even if it is a minimal bleeding, please do not ignore. You need to seek help. And why am I highlighting this? Because even though there are lot of other factors which would have brought about this, but there are a lot of other commoner things which can bring about this. But what we want to rule out is that you do not have a uterine cancer, and it is a must and should to rule this out, even if you have had a small amount of bleeding. So do not neglect is all I'm trying to say, because this should be your take home message broadly. Okay. So postmenopausal bleeding is not normal. Okay. That's all you need to know. So a very basic test will be done. Just a transvaginal scan. It is basically a scan which is going to, just see the lining of your uterus and see if there is any problem associated with it, especially if you have had a history in your family of breast cancer or ovarian cancer, or your first degree relatives or people in your family who have had even an intestinal tumor or a uterine cancer. There are all these belong to a common group where you will be much more prone to develop the disease if you have a family history of any of these cancers. So please remember that you need to stay, you need to remember these points. You need to stay focused. You should not ignore any of these problems, because the outcome can be drastic, and it can be very simple if you seek help at a very early stage. Okay, so in general, as you approach your perimenopause or the menopausal age group, as I said, your estrogen was a protective factor so far. It was helping your fat metabolism. It was helping your bone metabolism. It was keeping a check on your sugar. It was keeping a check on your BP. But as you approach menopause, you know that your friend estrogen is slightly reducing. And finally, you need to know that you might develop any of these problems. So you need to go and get yourself checked so that you know your baseline, so that you know your BPs are fine, your sugars are fine, and you need to start taking your supplements, vitamin D and calcium supplements. So thank you very much for your patient listening. And I will be waiting for your queries so that we can discuss a few points if you want to ask me something.
Any queries you have, you can just ask.
Post in the chat.
Yeah. Ma'am, I think we have one.
Chat box. There's a question.
Yes, you can just. There is a question.
Okay, I can see a question regarding HPV vaccine from Archana ma'am. So first of all, we would like to know what your age is. You can definitely visit the OPD. We will give you an idea about what the vaccine, what is available here and when you can seek the vaccine. But as I said, up to 26 years, it is definitely recommended. But 26 to 45 years, we will have a word with you regarding how much benefit you will be gaining, because the vaccine, you would have already developed the antibodies required by that age group if you're above 26. Okay, the recommendation is up to 26. It can be taken, but 26 to 45, again, it is a gray area. We will discuss with you further. And if you think you require it, you can definitely go ahead with it.
Any other questions? You can unmute yourself and ask questions, participants.
Hello.
Yes. One more question.
Hello.
Hi, ma'am. Tell me. Yeah, I can hear you. Tell me.
Yeah. Thank you so much for a wonderful presentation, ma'am.
Thank you.
I'm actually Kavya Shri from Civil Department. I
Okay.
have a question for you.
Yes, tell me.
Actually, I experience a headache whenever I have a menstruation, severe headache.
I am not able to hear very clearly.
Can you hear me, ma'am?
Yes.
Okay. I hope I'm audible now.
Yes, you are sort of
Yeah.
audible.
Yes, ma'am. It's why people experience headache and not a leg pain or a stomach pain or pain whenever they get the menstruation cycle. Because I get headache when I have a menstruation cycle and I don't experience any pain in my legs or in my uh, you know abdomen. I
Okay.
don't
So what you're
feel it.
saying is you don't have the usual dysmenorrhea, which we just spoke about, but you are experiencing a headache, is what you're saying.
Yeah.
Okay. So
Yes.
is this only during your period or even before that?
Only during a period, like how we get an indication that we get that we'll be getting a period, the abdominal pain, I get a headache.
Okay. Also, do you have a migraine problem?
No, I don't have.
Because what happens is most of the times those who have migraine problems, they can have this during this their period. And also there are some hormonal disturbances which causes something or is a premenstrual syndrome or a headache that can happen during your period. It is absolutely fine. You can visit your doctor once and discuss this more in detail. Probably you can come to us and talk to us about this in the OPD once.
Is it normal?
It is.
Okay. Thank you so much.
Yeah,
Thank you,
any
ma'am.
other questions? Any other questions, participants? Yeah, I think there are no questions. Ma'am, you just briefed about the importance of today's women, both at home and work, how to take self-care through stress management and through a balanced diet. You also gave some tips on how to get rid of problems during different age groups of a woman, which is very much essential for today's women. It was really an insightful talk. Ma'am, thank you so much. We on behalf of Team WGRC and CICC, we wholeheartedly thank you for giving such a wonderful talk on well-being of women, well-being of women. We will be looking forward the same thing even in future also. Thank you so much, ma'am. I would like to thank all the participants here, HODs,